Good evening, and welcome to our Evening Rounds podcast. My name is Dr. Anthony Hilliard, and I'm one of more than 1,000 physicians here at the Faculty Medical Group at Loma Linda University Health. Tonight, I'm super excited to have Dr. Laren Tan with us. Dr. Tan is a COVID physician. He's an intensivist. He's a pulmonologist. More importantly, or equally important, he's a father. He's a husband. He's a fantastic athlete, and he's a man deeply rooted in faith. If you like what you hear and you want to check out prior episodes of our podcast, please go to Spotify, Apple Podcasts, YouTube, or our Evening Rounds webpage. Click the link to subscribe. Hello again, and welcome to our Evening Rounds podcast. Joining me, as always, is our co-host, Kelsey Kohler. Kelsey?
Hi there, and I'm the Executive Director of Communications here at Loma Linda University Health. I'm so excited that we have Dr. Tan here with us tonight. Dr. Tan, I know I get to work with you often with our media requests and some of our other communication and marketing things we're working on, but I'm so excited tonight that we finally get to see a little bit more about who you are as a person and kind of what's behind the white coat there for you.
So Dr. Tan and I work a lot together. I'm going to call him Laren for the rest of the evening because Dr. Tan sounds too formal.
It is.
But Laren and I get to work on some really fun projects in our administrative functions within the faculty medical group. And so I feel like I know you quite well, but I'm excited to hear things that I may not know about you this evening. I think it's important for our listeners to know that Dr. Tan, Laren, is a who's who for a pulmonologist. In fact, when I needed a lung doctor, who did I call? Well, I called Dr. Tan. He's sort of the pulmonologist for physicians. And I think that speaks a lot to the type of individual that Dr. Tan is. Mm-hmm. But he's also well respected in his peer group. He currently serves as the president of the California Thoracic Society. It sounds like a big deal to me. And there's a lot of other hats that he holds here as medical director of the hyperbaric oxygen therapy department and some other things. And I get all that, but I have a much more important question for you. When was the last time you ate something sinful? I say that because you're a man of health and wellness, but I know there's got to be something in there that you can confess that you may have eaten that you maybe shouldn't have.
I'd hate to really confess to this. This past weekend, we stayed at our in-laws, and I had a chocolate donut.
A whole chocolate donut?
A whole chocolate donut.
Last weekend.
Just this past, and only just because the kids decided to give me what they couldn't finish. So,
Wow. Obviously, health and wellness is a big thing for you, and splurging on one donut, I think, is okay though.
Yeah, it was a very tough decision, but
I hope you don't live to regret it.
I hope not either. I know that you've been really busy, and I'm really grateful actually to hear that you've had some family time, because I know you've been working incredibly hard right now in the ICU with our COVID patients. Tell us a little bit about what that's been like.
Working with the COVID patients has definitely taken, I think, a lot out of me emotionally, mentally, and also it's been a struggle spiritually too. To be able to see a lot of these COVID patients actually go through what they're going through alone has been the toughest part for me. On the family side of things, there's always that fear of going home and giving either my mom or my kids or my wife something that they didn't have or they shouldn't have. And so it's an added stress. But I will say that, it's been an absolute blessing to be able to see at least our family come together to realize that there are going to be different things that we need to do differently now. My mom won't let me come near her or even kiss her goodbye. It's just more of a wave. But I think there's a light at the end of the tunnel, and that soon enough, hopefully we'll be able to get back to our usual self and things. So it's definitely been a whole lot, but I've been very most impressed actually with the camaraderie, at least within our medical ICU, what our university has done to keep our faculty safe. So all these things put together has really given me more peace.
So my husband works in emergency medicine, and we have a whole routine for when he comes home and where where the hugs happen and where the scrubs come off and all those things. Do you kind of have that process with your own family? It sounds like that's pretty ironed out for you guys too.
We do, and I think it's definitely been modified as the months have gone by.
Yeah.
Um, yeah, from short of running around the house naked, right, straight to the shower.
Yeah.
Uh, it's been very interesting. It's been fun times.
Wow.
I'm still getting over that sight that you just described, but in all seriousness, though, I was taken by a comment you made about how it was testing you spiritually. I'd like to know a little bit more about what you mean by that.
You know, being in a faith-based institution, I think one of the greatest benefits is being able to pray with our patients, being able to provide an aspect that perhaps other institutions may not be readily to be able to provide to their patients in the care that they provide as a whole. And, a lot of times we want to be able to see through prayer that things actually work out for the best. And with COVID, it's actually been very difficult, especially with a lot of patients that come in with various different comorbidities or other health issues. So, initially I'd say that I would have loved to be able to see a more rapid recovery, but we haven't been able to see that. But there has been recovery. It just takes a little bit more time. And so spiritually, it's been taxing in that sense because I was anticipating something, I was wanting something, but I felt I was being taught a lesson, and I think that's just to be more patient with things.
Wow.
You know, as a cardiologist, we have been consulted on patients with COVID, and candidly, I've been very nervous to go and see them. We do everything that we can to keep our providers safe. I've thought many, many times what it would be like for our nurses who are caring for those patients for an extended period of time, and our critical care physicians and hospitalists on our COVID units that are doing the same. I have to ask, back in March or April, were you nervous to see COVID patients? And if so, how did you get through that? And then, are you still?
That's a tough question, Anthony, because I'd say a big part of me is still nervous. Still nervous. I don't think necessarily for myself, but really for others and what they may experience if I were to be infected and then pass that on, whether that be to my patients that I'm seeing in clinic or even, like I said, my mom and dad at home, or even my in-laws too. Back in March, I'd say my fear was a lot higher. I felt extremely vulnerable. That was the biggest part that I felt, because being in the ICU, we're more or less in a controlled environment. We understand our roles. We have a better understanding of the various different disease processes. Sure, the outcomes sometimes are out of our control, but we had a better understanding, and I could at least have a better pulse on how things were going. But when COVID first came out, there was a lot of unknowns. A lot of unknowns that so much so it leveled the playing field, that the person that was in that room and what they were experiencing, you weren't quite sure if you were going to be in that same situation tomorrow. And that was hard. That was extremely hard, especially since we had no proven therapies at that time. So with that being said, even with some of the proven therapies that we have, even right now, there's still that vulnerability. I'd say I've gotten a little bit better in that, but it's definitely still there.
I feel like in the ICU and the intensive care unit, you see probably day to day a lot of difficult things. You see a lot of sick patients. What specifically led you, number one, to medicine, but number two, to be a pulmonologist? And what does that really mean?
Oh, that's a great question, Kelsey. I looking back and reflecting, it's interesting because COVID did make me reflect and also think about why is it that I want to put myself in this situation that I'm actually in. Because many a times it'd be nice to not have to worry about that, and go about my day. But I felt it was a calling. It truly was a calling to help out and do and make the most difference where I felt that I could. And for me, it was being in the intensive care unit. And I'd say it's an absolute blessing because I felt that transitioned a little bit more because that transitioned more towards pulmonary into the lung aspect of things and where I can make the biggest difference. And so that's where it's actually helped me to be able to refocus and also understand what I'm doing and what I'm doing now.
Wow.
You know, you did your training here, and then you left to further your pulmonary training with your pulmonary fellowship at UC Davis. How did we get you back? What brought you back down here to Loma Linda?
I think it was an answered prayer. The story behind while we were at Davis, we had our son Nathaniel when we were in residency here with my wife,
Wow.
who was also going through family medicine residency. We got into fellowship, and interestingly enough, during fellowship, she said, "Well, you can go anywhere you want to go. Go for pulmonary critical care, just go." I said, "That's perfect." We stayed for residency, gave me an opportunity to go East Coast, Midwest, just figure out where we could go. It'd be something different. And when I told her, where are the areas that I thought I wanted to go, which was really East Coast, she said, "Oh, that's nice. You go ahead and go." And I said, "What do you mean?" She said, "Yeah." I said, "You can go wherever you wanted to go. I didn't say that I was going to go with you."
Wow.
Well, that totally changed everything, especially with Nathaniel. So we had we re-strategized everything, and Davis just was the perfect fit. And I think it was an answered prayer then too. Being there, fantastic training, met the greatest people, and until this day, still keep in contact with them. And when we were done, the question was again, "Lord, you led me to Davis. Now where do you want me to go next?" And while we were up in Davis, we actually had our twin girls, Bridget and Caitlin. And believe it or not, we were flying my mom up almost every week just to help us out.
I believe you. Both of you were in residency at the time.
Well, my wife was working in family medicine already that time, but we already had Nathaniel. And Anthony, I think you can attest to this. In fellowship, it's rough. We leave early hours, you come back late. And so having twin girls at home was a lot. And when we were done, my wife said, "We need to go back. We need to go back where family is in Southern California." And so it took a lot of prayer, and it just really worked out.
That's eerily similar to my story. Happened maybe 6 years before yours, but I was at Mayo for 7 years and did my residency and fellowship there, and we had both of my children there, Max and Sophia. And then there was a chance to do a postdoc basically at Mount Sinai Thrombosis Institute to study platelet biology for 2 additional years to start doing more of a bench-based practice. And, my wife said, "Anthony, time out. We've been going at this for 11 years since college. We got married after college, and I'm just ready to sort of settle down." And I thought that was a really powerful message because, in all honesty, what resonated with me is what you said about fellowship. And, I'm not it's not something I'm proud of at all, but I was an absentee father. My wife was the dad and the mom for the majority of our time, just simply because my work consumed me. I think we have to be careful. Because just because you finish fellowship and now you're done with your training, that doesn't mean the work doesn't consume you. In fact, I would argue that I work more hours now than I did as a fellow. So my question to you on that standpoint is, what's your check? You hold many different titles within the organization. You have many responsibilities within the organization that aren't necessarily 8 to 5. So what's your litmus test? Laren, I can't say this. I can't do this. I have to stop. Is it Heidi? Is it you? Is it your prayer? Where do you say, okay, time out, I am stretching myself too much?
My litmus test, I'd say first and foremost, is my wife. She is probably the most, she's an amazing woman, and at the same time, just as amazing in telling me, He doesn't know he needs to stop. That was very apparent during med school when we were having a conversation with another, a classmate of ours, and I was trying to explain something interestingly about the ear, and she straight up turned to him and said, "He doesn't know. Just move on." And so
I love that.
And I think, just the brutal honesty of my wife has been that test.
Wow. It seems like Dr. Hilliard mentioned, you wear so many different hats. In my head, you work, 12, 14-hour day. You don't take a lunch break because you've taken a meeting during that time. You are charting, you're doing all the things. And then you get home and I'm sure you have some family time. And then, you kind of go on to your second job, which is really the marketing and communications aspects of what you do for the faculty medical group. And then in my head, you go for a light half marathon before bed. I mean, where does that motivation come from? How do you maintain this high level of pushing yourself continually?
Well, first, Kelsey, I think you've given away actually a book that I was planning to put out, which is How Do You Stay Lean? And that's to just schedule meetings through lunch. That's really like a key.
It's your strategy, right?
It is. It's a big strategy.
Were you raised in that environment? Do your parents play into that, or is this something that you gained later on in life?
Oh, my parents are, immigrants from Singapore, worked very hard to provide the future that we have currently, even now, for me and my sister.
Wow.
And at least for me internally, that continues to motivate me is actually biblical in a lot of ways. And it stems from James 4 and also Colossians 3. And if you summarize just in those aspects for what it means, do everything and do it great for God and His good and for His honor. And at the same time, it's also our life is but a vapor in this world. So and it's something that always resonates within my mind that one, our time is short. And at the same time, whatever I'm going to end up doing, I'm going to do it to the best of my ability. And I'm going to do the best of my ability, and God will take care of everything else from there. And so just having just those two aspects are what really motivates me and what pushes me. And then when we have moments of clarity and joy of being able to highlight, in the marketing aspect of things. Like, for example, I was on call last night. It was a rough call. And then today I got a call from marketing communications, public relations saying, "Hey, we need a physician to go out in front of news media to be able to link that physician and also a nurse." It just rejuvenated me. It gave me more energy to go again.
Really?
To go again. Because we have so many great faculty here at Loma Linda, so many just awesome people that I want our community to know about. And it just brings me joy.
It's amazing because you really have, connected us so much with some of those amazing speakers, and you yourself go in front of the camera. Is that because you want to help educate the community, or why is that? Is it your love for Loma Linda?
I find that at least within Loma Linda in our institution, we have probably one of the most humblest, personality type of physicians we have. Yet at the same time, with that humility, we have some of the most prolific clinicians and researchers here. And I think sometimes just as a religious institution, we've held ourselves back to be able to let others know just the great things that we're actually doing. And I don't know, I guess I could say I find it part of my mission and purpose here to be able to help promote. I don't know, I pictured myself as that sideliner, as that clinician marathon runner runs by, and I'm just cheering them on, and occasionally I'll jump on that path with them and run with them and help them to finish out to the finish line, and then we're just all rejoicing. And to what Anthony said, then we move on to the next round and we all go together. So it's great.
So I learned something about you in preparation for our podcast this evening. I know you're the entrepreneurial type. You have a webpage, larentan.com, and you have nice photos. You're very photogenic. I was impressed.
Indeed.
Mine, again, is best for print. It's not for pictures and so forth, which it was cool. And I wanted to kind of get a sense for what the background for that was. And then I also came across this Ignis Medical Innovations, for which you're the founder of. And it is affiliated here with Loma Linda University Medical Center, and it's to find innovative solutions to problems facing the medical world. It's sort of, going big, right? I mean, that's not like an easy sort of small goal that you have for your company. So I would like to know, first off, where that innovation comes from, and what are you doing with this company?
Well, coming back to Loma Linda, I think there are things that we can continue to improve on. And part of it was, how can we utilize technology to be able to solve some of those problems and be that solution. Ignis was actually started in conjunction with actually La Sierra University, where at the time we were having just a discussion on how can we actually utilize augmented reality to help us out with ultrasounds and
Oh,
also some
wow.
procedures. And interestingly enough, last year had a contact with Brother Incorporated, who was actually making a lot of augmented reality glasses at that time, which was a cheaper version of Google Glasses. And one thing led to another, and Brother actually donated augmented reality glasses to us for research, and also to be able to see how else we can use it in the medical field. And so we found that there were various ways to be able to link this augmented reality glasses, one to ultrasound machines that we actually had. So no longer did you have to keep your eyes off the surgical field when we were doing perk trachs. We could actually use glasses to keep our eyes still on the surgical field without ever looking away to see what the bronchoscopist is doing.
What is a perk trach?
A percutaneous tracheostomy
Oh, thank you.
is
It's
essentially
a $10 word.
Yeah, it's actually, no longer are we actually going to be using an endotracheal tube when someone's put on life support with that tube that typically goes from your mouth into the trachea, but now it'll come out externally.
Wow.
Yeah, you could say in the long run, it's much easier, it's more comfortable for the patient, but it is a surgical intervention that we can do actually at the bedside in the ICU.
Wow. So you essentially made that process so much easier.
Yeah, we made that process easier. We formed a great partnership with Brother. They actually donated multiple units that now we've actually distributed out throughout school at Allied Health, and also our simulation center, and also internal medicine. And so Ignis has really morphed into, I'd say, a stepping stone into what we could do further. As what we'll probably talk about, and hopefully be able to promote a little bit more as our creative innovations and communication and branding team.
Speaking of which, I know all the fans want to hear about this, but you have consulted on Grey's Anatomy. So you've done a lot of unique things to kind of further the marketing communications field. So tell us a little bit about that experience.
Oh, that was an absolute blessing. And I think I would say some individuals in marketing and communication actually found it even bigger blessing than me, because I guess I'm going to be on air. I have not watched Grey's Anatomy since like maybe the first episode. But there were others on marketing communications that knew every episode and every character. But interestingly enough, USC's medical writing, I guess that you could say part of their university, actually reached out. And I think it was also just part of what we were doing here and what we were promoting from our marketing communication websites for hyperbaric oxygen. And they were looking for a medical expert to give them medical advice on a particular episode. And in exchange, they invited us to the set. And so it was great.
I love that story. I love that you were able to be in that world too. Obviously, there's so much, science that we deal with, and where, you're incredibly, incredibly intelligent, but obviously being able to consult on that and being able to talk through some of the intricacies of hyperbaric medicine, which, while we're on it, what does that mean?
Hyperbaric oxygen, essentially we have to distill it down. It would just being in an environment that's under pressure with 100% oxygen. And by utilizing that in a patient or someone's in that environment, we're able to enrich not only just the blood, but also the fluid that the blood is floating in with oxygen. And that helps the healing process for maybe stubborn wounds or even different medical conditions.
Part of what you do, and we touched on it briefly here, is, and listening to all the things that you've accomplished, it seems like you're in the right place for the creative innovation, communication, and branding team within our faculty medical group. One of the things that I was intrigued by when we were chatting about this concept was how active you were in patient education. Marketing, to some people, may think that this is a way to grow a brand or make a doll or things like this. But I get a sense talking to you that marketing to you is another way or term to talk about patient education, to talk about the services that we offer, obviously, but it's about educating the patient on what's available, and empowering them. You work with Janelle Ringer a fair bit in press, media, things like that. Can you touch on a little bit of those successes and give the audience listening this evening an understanding a bit of the scope of what we're talking about? We're not talking about 100 people or 1,000 people. I would like to get a sense from you, how many individuals have we targeted or have been impacted by the communications that have really come out of a lot of hard work on your end?
Working with Janelle Ringer from Marcom has really been, I think, probably one of the joys actually also in working here at Loma Linda. Her insight, her input into just the various different public relations opportunities is great, and to be able to provide the flip side, which would be which medical provider would be able to best communicate that in a fashion that would be understandable to the audience we're trying to reach,
Right.
and it is, I think, key. And Anthony, I think you touched right on it, and that is the patient education side. I think comes a lot with the way we communicate with them, not necessarily talking down to them, but really talking with them, and then also giving them hope and insight into whatever disease process we're actually talking about. So when we actually here at Loma Linda, and I'm just going to use, earlier we said creative innovation, communication, and branding, and in short, we'll say it's CICB. But whenever we're looking at it from that perspective, when I see it from a CICB perspective, it's to really look at all the different providers we have, and also find that gem or that hidden jewel that has been here for like 20 years, that has been communicating extremely well with patients, but just the community just doesn't know quite much about that provider. And so when that opportunity comes, and when Janelle gives me a call, I go, you know what? Dr. So-and-so would be fantastic for this.
Mm-hmm.
And he or she has the medical expertise for it. And whether that be for news media, whether that will be for a reporter that wants some insight, or even for Zoom or national TV Live, it really, it's about finding that right provider within our group. And the masses that we have reached has been the hundreds of thousands, and you multiply that by the hundreds of providers that we have been able to link together. It's astronomical when you actually see the growth and the projection of how, when we as CICB work together with Marcom and meet the needs of the community.
Absolutely. I feel like the first time you ever came to the marketing communications team, you said, I'm doing this thing that no one knows about, and we have a whole community that may have this problem and needs to know about this. I mean, I know you have a passion specifically for asthma, and I just think it's amazing that, it seems like that is your mission. It seems like that is your goal, is to be able to empower some of these different groups within our community and around the world, frankly, to know that we do this and we can help them. Is that kind of what's driving a lot of that for you?
It has been. And I think that also goes back again to, earlier, I think God's just got a really special way of just trying to teach you different things, and patience is one of them. And with asthma, the reason why I love asthma is that with the right treatments, the right inhalers, or perhaps the different therapies, you can have just such phenomenal benefits in such a short time frame. And that may not be ordinarily true for a lot of pulmonary diseases. And that's why I love asthma, and to be able to have a whole spectrum of age patients to be able to treat and make that difference, again, gives me purpose.
So I sought your medical advice a month or so ago with the fires going on. And, you facilitated things, you texted me. There's a commercial that Aaron Rodgers is on. I think it's a State Farm commercial, and it's like, I got the special rate, right? So did I get the special care, or I mean, is that really what you do? Because I was like, I felt like I needed to like buy you flowers or something. I mean, it was truly remarkable. But I mean, and you assisted with the care of my wife at one point, also did the same thing. I assume it's because she's got the Anthony Hilliard good deal, or is this really who you are?
I you know, I boy, that's a tough question, Anthony, but I'd like to say that I do provide that service for everybody else too. Only just because that is just what I do.
Yeah.
Man, that's great to hear. I'm a little disappointed, but also very proud at the same time, because I was just truly impressed. Even as a physician, when I was having some difficulty breathing, I mean, that's very disconcerting. I'm very physically active and exercise multiple hours a week. And when I was feeling tight and not like I was able to perform, to your eyes, it's what you do every day. But the ability to take the time and the energy to understand my concerns, and then to create an action plan to address my concerns, and then to follow up with my concerns, is truly remarkable. You still, to this day, initiate some of those texts just to inquire how I'm feeling. And that's not me reaching out. That's just you and your hundreds of other things to do on this particular day, reach out to Anthony Hilliard. And I mean, I have to admit, I was extraordinarily impressed by that.
Well, praise God. I'm glad. And also, it's probably also because I knew we were coming up to do this podcast, and I need you to breathe and be able to talk well. So
thanks for that.
We appreciate that. That's good.
No, that's awesome. So the name of Evening Rounds was intentional. We had prayerful thought. We toyed and tossed around a number of different names, and you were instrumental in providing some of those names as well. And we really vetted them and thought about them, and I kept coming back to Evening Rounds. And to me, Evening Rounds as a physician means a number of different things. Evening Rounds to me meant seeing the sunset from the hospital windows. It's having end-of-life conversations with families who were able to get off of work and now come in and see their loved one. It also it represents to me the other part of my life. When I leave the hospital, what are things that I do that enrich my life? Whether that be spending time with family, friends, doing sports, reading, whatever. And so Evening Rounds to me has multiple different meanings. But if I would ask you, Laren Tan, what Evening Rounds means to you, what would it mean?
I would invite you and Kelsey to come on over one of these nights to our home and watch a movie with us, with the Tans at night. I think it's just one of the most absolute craziest things I think I've ever experienced, and I'm starting to experience. And why is that? Because Evening Rounds at night at the Tans when we're watching a movie is like having, we've got 3 kids, my wife, and myself, of course, we're watching a movie, but it's 4 people commentating about a movie we've never watched, hypothesizing what's going to happen next, and then also just giving little offshoot comments, so much so that you don't even understand what was happening in the movie, only to believe what that person who was just talking the loudest was actually saying. And amongst all that chaos, when I'm hearing, and Anthony, what you talked to me about Evening Rounds, that to me is almost where I feel like I belong during that time. Just at that moment, that even if life is chaotic, it is still the best and most enjoyable thing for me during that time. And so, I'd say that is definitely one aspect of Evening Rounds for me. Being at home with kids that at times will end up driving me nuts, but still give me joy at the same time.
What was the last movie you and your family watched?
Free Willy.
Oh my goodness. The throwback.
Yes, which was the most interesting thing. I think by the end of the movie, we didn't even know it was about an orca, really. That's something totally different.
Wow.
Well, that we could talk for hours. There's just so much there. I can't thank you enough, Laren, Dr. Tan, for joining us this evening. And to all of you, thank you so much for tuning in to Evening Rounds podcast. Until we meet again, Have a good evening.